Hey everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. And I want to talk about something that is so common, and it's something I see all the time in my practice, and is so critical. It's really much more serious than people think about, and that's back pain, or what we call sciatica. You know, as a chiropractor, my job is not to treat sciatica. My job is to look to see where the spine is out of alignment. Now, what we find almost always, not always, but almost always, if the spine's out of alignment for a long time, it can lead to sciatica. Absolutely, 100%. But let's look at that for a minute. Let's step back, way back for a minute. Step way back, okay? I know some of you guys listening to this might be hurting right now, and you're thinking about your leg pain. I get it. But think about this. What is your nerve, and what's happening to the nerve? Why do you have a nerve in the first place? You know, when you start to really understand that, you realize that, look, at your nerve is a conduit of electrical messages. It's a piece of hardware, like a wire in your house, and it allows electrical signals or messages to flow through it. And those messages go to different parts of your leg, if you will, if it's sciatica, or it could go anywhere else, right? And it gives vital information. So it's not just that nerve that's being damaged right now that goes to your leg that you feel, never even knew you had it before, is being affected, causing pain, but that nerve also controls how the skin grows, the hair grows, the health of your leg, meaning the muscles, the tendons, the ligaments, the synovial fluid, the cartilage, all of it. So when that nerve gets sick, not only are you feeling pain, but you're jeopardizing in a significant, severe way the entire health of the leg. It's critical to understand that when the spine is out of alignment and those nerves are pressed on, that whole body part that is responsible for that nerve, or switch that around, is getting sick. It's getting diseased. It's not working as well as it's supposed to. Here's the other important part. You can have the nerve damaged by up to 60, 70%. So the nerve can be compressed, losing 60 to 70% of the information that goes through it without ever feeling a symptom. Isn't that amazing? But if we think about it, the heart's the same way, right? We can plug arteries in our heart 70, 80, 90% before, God forbid, I ever have a heart attack, right? And we understand that 60, 70% die from their first heart attack, and the moment before their heart attack, they felt fine, so they thought they were what? They thought they were fine. So when we talk about sciatica or any type of neurologic problem, we have to really step back and understand that this is a very significant and serious problem, because it's not just the leg pain, it's greatly affecting all of the life of your leg or your back or your arm or your heart or whatever, right? Because those nerves also go to my prostate, they go to my colon. So you can see people with sciatica, they have a lot of hemorrhoids, they have prostate problems, they have rectal problems. Women, they'll have certainly bladder issues, men as well. They'll also have maybe problems with their uterus, they'll have a lot of pain during birth, during the menstrual cycle, and I could go on. And why? Because those nerves that innervate the sciatic also innervate those organs as well. So anytime the spine's out of alignment, and that's an important word to understand, that's a vertebral subluxation. That's a word that is specific and unique to me as a chiropractor, kind of like gingivitis is to your teeth, or arterial sclerosis is to your heart. Vertebral subluxation means the spine's lost its position or mobility, and it's affecting the nerve in a negative way. That means information can no longer pass through the nerve as well. So you're certainly getting some messages, but not all of them. And over time, like heart disease or what have you, it's an accumulative effect that can cause a lot of severe and what we would consider unrelated, which is directly related. But most often people unrelate the leg to any type of visceral problem. And I would tell you it's just the opposite. Many times you'll have visceral trouble well before you feel the pain or orthopedic pain. We know that children are, by the time they're 10 years old, have had 10,000 falls, 4,000 to 5,000 significant falls. We know that children by the age of 14 start the beginnings, boys, it was the most recent study, start the beginnings of degenerative arthritic changes within their spine. So when you feel sciatica at 30, 40, 50, 60 years old, you have to understand that that condition, like heart disease, began decades before you ever felt it. And the idea that you're going to swallow down some Motrin or get a block or somebody's going to go in and cut it all out, and that solves the problem, because some of those things you may need to do to tolerate some of your pain. I'm not saying that, you know, you shouldn't do that, but my reality is if you don't correct the subluxation, the problem's never corrected. That's why back surgery is such a failure. That's why you see people get addicted to these drugs and so forth, is even though they may offer relief, they're not getting at the cause of the problem. And almost always, not always, but almost always, when it comes to those nerve pain problems, they're almost always the result of vertebral subluxation. The best way to proceed is this. Get your spine checked now. Don't wait till you hurt. Don't wait till you have a heart attack before you get a chest x-ray, if you will, or an EKG or something of that nature. And the same is true with your spine. The best time to have it checked was when you were a child. But listen, you're not a child anymore. So the second best time to get it checked is now. Don't wait till you hurt. Don't wait till you have all kinds of problems. You got to understand that the #1 cause of disability in the United States is back pain. One of the #1 reasons to have surgery in the United States is a spinal condition. One of the #1 reasons to take medications and drugs is for spinal pain. One of the #1 reasons to be addicted to medication is for spinal pain. So, you know, the reality is, why would that be working? Because we're all jumping on the wrong solution. Those aren't solutions. All you're doing is adding to the problem. So if you need to do that for a short period of time, you do what you got to do. But the reality is, go to the chiropractor, get your nervous system checked, and care for it like your teeth. So don't wait. You take care of perfectly healthy teeth, and therefore they stay healthy. The same would be true with your spine. And I could go on and on all day. Find a chiropractor in your area, somebody that you hear good things about, that looks good, that's busy, and find somebody and say, listen, would you take care of my spine? Would you take care of my family's nervous system now and for the rest of our lives, so that we stay healthy and run and operate and function just like we were intended to? That's the way you move forward with a healthy nervous system. And that's a great way, though there's many ways, that's a great way to prevent ever having sciatica or back problems and so forth. Because again, they're the result of long-term damage, almost always from vertebral subluxation. Guys, this has been Dr. Joe Borio with this week's Change Your Health, Change Your Life. Remember, you got to eat well, you got to exercise, you got to what? Drink a lot of water, get a good night's sleep, talk good to yourself, make sure you make a good affirmation, saying positive things to yourself, because you probably beat yourself up all day. You better say 5 or 6 good things to your own self. And remember, you, your mother, your father, your grandfather, your aunt, your uncle, your cousins, your coworkers, everybody you know, everyone you care about, make sure you get them under chiropractic care. Guys, enjoy the week. Have fun with your family. I'll talk to you in a week.